They say sacred cows run in herds. Well, somebody put a target on that big one called public only healthcare in Canada. It was Danielle Smith and her government in Alberta announcing imminent legislation to effectively create a two-tier public healthcare system. This is going to be the focus of the first half of today's roundtable. I'm joined by Sean Speer, my co-founder and editor at large. Hey, Sean.
Hey, Richard. Great to connect.
What a wild week, eh? As soon as you and I saw this story, I think we both thought, wow, this is probably one of the biggest developments in healthcare, and all the debates around it that you and I have been part of for the, I don't know, the last 2 decades, at least in my case, or more. And here it's arrived. Why did you feel, Sean, that this news out of Alberta, and you could explain to our listeners and viewers exactly what the government seems to be proposing, is sending earthquakes through the healthcare establishment and many of Canadians', I think, long-held assumptions about how and where and why healthcare is delivered in Canada in the way it has really since, I don't know, the 1970s?
Yes, that's precisely right, Rudyard. If these reports are accurate, and in the coming days, we'll have legislation from the Alberta government that would establish a parallel private healthcare system and enable doctors in the province to toggle back and forth between the public insurance model and delivering for-profit care, it would represent not just the most significant healthcare reform in my lifetime. I think you could make the case it represents one of the most significant center-right reforms in any policy area, with the exception of free trade and a small number of others. As you said in your introduction, the single-payer model when it comes to hospital and physician services has been the sacredest of the sacred cows. It isn't just about technocratic questions of how we deliver healthcare. It's been swept up in conceptions of national identity
Hmm.
and how we define ourselves in juxtaposition to the Americans. And in spite of all of that, the evidence continues to mount that this monopolistic system is producing really poor outcomes.
Yeah.
Not just long delays and all the rest, but growing evidence that people are really experiencing pain, suffering, and in significant numbers of cases, actual death because the rationing inherent to the public insurance model is not getting people the treatment that they need on a timely basis. So, if it's indeed the case that the Smith government is going to take this issue on, I think it will put Alberta front and center, Rudyard, pushing the types of reforms that the system desperately needs. And in that sense, I think we maybe look back this week as one of the most significant in the history of Canadian healthcare policy.
Yeah, well said. And look, before people start, throwing buns or worse at their speakers, either audio or television, if they're watching our YouTube channel, because they are diehard defenders of the single payer system, I just want to remind us all that that system now in most provinces is consuming close to 50% of all tax revenue, all government revenues. It's starving out higher education. It's starving out necessary investments in infrastructure. I would argue that it's a strategic drag on our response to the Trump threat and America becoming an unreliable ally. If we are allocating 50% of all, or approaching 50% of all provincial budgets to healthcare, to a system, as you note, Sean, in many cases is denying people the ability to access a family doctor, is denying people timely medical care. In the province of Ontario, we now have stories coming out of people with stage 3 and stage 4 cancer being sent home without treatment plans for their advanced metastasis. I mean, this system is broken. And
Yeah.
we'll have to see what the details are of the Alberta plan. And I think the Hub is going to hold itself editorially in reserve because we do think there are issues of fairness and equity that need to be addressed. But simply arguing that the status quo can be preserved indefinitely is not an argument. It is a denial of a multifactorial reality regarding how the single payer system is a millstone around the neck of not just taxpayers, but all kinds of different parts of the economy, different parts of the public sector, from education to public infrastructure, you name it. Sean, the resistance, though, has begun. So maybe break that down for a little bit for us. Where are you seeing people come out against, again, an idea that we're going to have to see the details in terms of this draft legislation. But as you and I commented as the week wraps up today, Friday, wow, has Danielle Smith ever, poked a proverbial beehive here, and out come the usual suspects, the usual defenders of the single payer system? What's the counter argument that they're putting forward?
Yeah, well, before I address that directly, it's worth pulling back the camera lens a little bit and getting into how this story is actually played out. We had an exclusive report in the Globe and Mail earlier this week. The reporter managed to get her hands on some background materials for this draft legislation. In other words, Rudyard, this was not a proactive government rollout. It seems pretty clear that it involved a leak, perhaps from the Alberta Ministry of Health or some other source. And so the opponents to these types of reforms have a bit of an advantage. They've been able to get out early and mobilize, and you get the sense the government is now scrambling, perhaps to table legislation sooner than it intended. Premier Smith released a video on her social media accounts that didn't get into the details about the legislation, but at least set out the government's thinking and narrative that I thought was a useful counteract to the reactions we're already seeing from the Canadian Medical Association and other voices that have become, I would argue, dogmatically committed to preserving the single-payer model in spite of the mounting evidence that it is just not working. And it's not working, Roger, this must be emphasized, even on their own terms. As you allude, I think a lot of the people involved are motivated by egalitarianism, the idea that people should be able to access healthcare irrespective of their financial means and so on. And I think an idea that we both share. No one is challenging the basic assumption of universality, but the fact is, Rudyard, people can go and purchase healthcare right now. They can go out of province. They can go to the United States if they have the
Yep.
means. This is kind of egalitarianism run amok, it seems to me. And so we're going to wait to see, as you say, what comes from the Alberta government. But in principle, the idea that the Alberta government would permit doctors to work in both the public and private system, increasing the supply of health services in order to try to get at the structural gap between supply and demand. And it must be said, in addition, maybe creating a bit of a pull, Rudyard, for physicians and medical professionals from other parts of the country, other parts of the world to come to Alberta. This represents, it seems to me, the most systemic, structural attempt to get at the underlying problems of Canada's healthcare system. But make no mistake, and I have no reason to think that the Premier and her government aren't attuned to this. They are setting themselves up for one of the biggest political fights that we've seen play out in Canada in a long, long time, precisely because there are so many organizations and voices who have attributed to the single-payer model not just a means of financing and delivering health care, but something tantamount to a kind of political identity or a political ideal. And so, yeah, we're standing by, but we're excited for what I think is going to be an important policy debate.
Yeah. And again, for people who are saying, oh, this is, American style healthcare coming to Canada. No, I mean, again, we'll have to see the details, but what has initially been announced here looks a lot like what happens in those wonderful Scandinavian countries, Sean, that we always laud for their progressiveness and their forward thinking, who precisely have a mixed system. Most of the rest of the world has a mixed system because it brings capital, private capital, into the system to support often public outcomes. The mandating of physicians spending a certain number of hours within the public system in order to access the privileges of private delivery and so on. It's throughout Europe, it's throughout the United Kingdom, it's all around the world. Canada, Cuba and North Korea and a few others are the holdouts, and it's a weird company that we keep in this. And you're right, it's become such a kind of dogmatic, hidebound view as to how we deal with an ongoing slow motion healthcare crisis in Canada. Question for you, and then a final comment to wrap up. The question is the Canada Health Act, Sean. What happens here? Because I always wonder, like, why now? Why has no other province done this? Why is Alberta choosing this moment? There surely must have been significant impediments to provinces to doing what Alberta is doing right now, because we are in 2025 and we know that we've had a public system in crisis now for a number of decades.
Yeah. So much to say in response. As you mentioned, Rudyard, one of the reasons we've not seen this type of reform in other provinces, besides the complicated politics as we've been discussing, is that it is prohibited under the Canada Health Act. So not to get too wonky, but in a nutshell, the Canada Health Act, which is a federal statute, sets out different principles or expectations that provinces need to abide by in order to receive their full health transfer from the government of Canada. Provinces that contravene those principles or expectations can see their health transfer from Ottawa reduced in the form of a penalty. As you say, it seems highly probable that the legislation from the Alberta government will be offside the Canada Health Act, which sets up a potential new source of tension between Ottawa and Edmonton. The province receives about $6.5 billion annually from the federal government in the Canada Health Transfer, and so it'll be an interesting question how the Carney government handles responding to eventual legislation from the Alberta government, particularly since the other big story this week is there seems to be a growing convergence between the two governments on a pipeline announcement that we could see as early as next Monday. But just when it feels like the tensions between Ottawa and Alberta are diminishing, as you say, one of the big aspects of this story will be how Ottawa decides to assert itself.
Yeah. My final comment is this, again, to skeptics out there, people that are pulling their hair at simply the idea of something different than our single payer system. This is exactly how our federation is supposed to work. The whole premise of having a federation is that you have innovation, you have experimentation. People do different things different ways. Some of them work, some of them fail. And I think if there ever was an area of public policy, innovation, experimentation that was required, it is healthcare. It's consuming, again, upwards of 50 cents of every dollar in many of our major provinces in terms of tax revenue. We need to figure out a new and different way to deliver the quality of care that people expect and demand. Alberta, I hope, goes forward and does this for precisely the reason of the competitive pressures that it will put on the other provinces. It'll put pressures on retaining doctors in other provinces. It'll put pressure on results in Alberta. They'll have to show that there are positive results from this change. And if there are positive results, other provinces, Sean, surely then will look at this and say, come on. Let's take the hair shirt off. Let's gore the sacred cow. I don't know, whatever analogy, metaphor, fairy tale you need to evoke. Let's do it. Let's do something different, because this is literally Einstein's definition of insanity, which is doing the same thing over and over and over again and expecting a different result.
Yeah, just brilliant stuff. I couldn't agree more. We have one of the most decentralized systems of federalism in the world when you look at the difference, the degree of spending by the different orders of government. And yet, in a number of policy areas, including healthcare, we have essentially adopted a one-size-fits-all policy across the provinces. And the result is that they're all performing poorly to one degree or the other. This represents, as you say, Alberta stepping out as an incubator of policy experimentation, possibly expanding the Overton window such that other provincial governments across the country can say, look, they've been doing this for 6 months, a year, 5 years, whatever. It's producing positive outcomes. A lot of the concerns haven't manifested themselves, and now we are going to move in this direction. This is precisely how federalism is supposed to work, and so I hope that, notwithstanding the pressure that the Prime Minister no doubt will face to intervene and provoke a fight with the province of Alberta, I hope he resists that temptation and let our provinces to be laboratories for reform. And I can't think of an area where it's needed more than in our healthcare systems.
Yeah, hear, hear. Well, the Hub will follow this story closely. We have an excellent interview with Brian Day, one of the real champions and agitators for fundamental reform of the single-payer system, up in our podcast feed and on our YouTube channel from yesterday. So check out that interview that Sean had with Brian Day. And if you're liking what you're hearing and seeing on this podcast and on the Hub, become a Hub Hero or a Hub Fellow for as little as $2 a week. And you're going to get the back half of the roundtable where Sean and I are going to talk about some of the good, the bad, and the ugly in Canadian media at this moment. There's a whole bunch of stuff going on, some big layoffs at Bell. We'll get into that. More bad behavior by the CBC. And oh yes, those AI overviews are coming for all of us in the media. We've got those stories for you right after this short break, exclusively for our Hub Heroes and Hub Fellows. Grab your membership now at www.thehub.ca, and we'll send you a link immediately to listen to the back half of this program and our other popular podcast, In Conversation with David Frum. Until next time, I'm Rudyard Griffiths.